I just completed the LA Marathon a few hours ago in what I hope is the US record time for a 66-year-old.
Frank Mesa is the real deal. You know, he walks the walk after he talks the talk. You know, he embodies Thrive. And he does it in a way that not only is he personally challenging himself to try to break a world record in marathons for his age class, but he's also giving back.
I never thought I could be a doctor. I just knew it was not right the way we were receiving healthcare. The only way we would get a doctor that could understand us is we would take a 3-hour bus ride to the border, cross the border, go to Tijuana, and get a consult from a doctor there.
Frank happens to be the best of all of us, and I think he exemplifies the kind of the uniqueness of really wanting to find solutions and wanting to reach out. And I mean, Frank is all about, you know, helping the community, not just the Latino community, but all communities of need.
And I think one of the biggest learnings for me in 1968 was to meet doctors, and I was convinced I was as smart as they were. I don't know why, but I just was. And you met a few doctors who actually said, you know what, I did it, you could do it. And again, that was very important. That was just really important. Somebody believing in you and saying that you could do something that you didn't even know was possible.
Well, when I look at Dr. Frank Mesa, I see part of a continuum, a generational continuum. So we got involved in our organizations, and Dr. Mesa and his cohort took that energy, they created their generation of organizations, and that continued up till the present.
It's really hard to put into words the enormous impact that Frank Mesa has had on this organization, Kaiser Permanente. There's a 32-year history of not only being an exceptional physician, but an advocate and a great supporter for diversity within the organization and outside of the organization.
So I was there at the start of the National Chicano Health Organization, Chicanos for Creative Medicine. I met kids from Northern California with Chicanos in Health Education. I became president of all those organizations. I was on their board of directors, and it was just nonstop.
And my dad was in LA. I had just applied to medical school.
And there was an undergraduate just kind of hanging out or doing her agenda from UC Davis, and that's where I met Tina.
And they actually knew a little bit about each other because my dad had been doing leadership positions in, I believe, Chicanos for Creative Medicine. And they talked, and my mom basically went up to my dad and basically told him, I know where you've been accepted.
We kind of met in a conference. I was pretty busy, and it was love at first sight.
This person cares, and they're going to try hard to do their best, be it if they're your doctor, if they're your mentor, if they're your chief. He's been a leader in our organization for many, many years, and he's been pushing our organization in the right direction.
He has mentored countless young physicians. He has helped us to understand better how do we create not only a more diverse workforce and create leadership opportunities for our diverse physician group, but he's also helped us understand how do we take better care of our members, of our patients from different populations that we serve.
I was adamant that this was the most important thing that we could ever do to eliminate or mitigate health disparities, because if you didn't have data, no one was going to move the needle in terms of providing better care to poor people and people of different races and ethnicities.
He is one of these providers that practices what he preaches. He walks the talk because he wants his patients to think of their health, to think in a prevention mode, to take active steps to increase their health, to be more involved in the prevention, and he does it by running. He sets the example. He models the way.
But I will tell you, in a marathon, even today, trying to set the U.S. record, there's tough times in it. There's easy times in it. It's always hard work, though, and you just have to push through it. And then some people cheer you on, but sometimes experience tells you that this hard 2 miles you're working through will get you to the 3rd mile, which will be a little easier, and then you're getting closer to the finish, and then you kick. It's kind of like that in medical school. It's like a marathon, and you get a C here, but you don't give up.
I think I just want to say congratulations to Frank Meza for an amazing career and for being an amazing mentor and something for our students to strive for, because I think if students learn his story and follow what he did, we're going to be the better. All of us will be the better. So congratulations, Frank, and adelante.
I just want to say thank you to Frank Meza. He's really an amazing individual. He was visionary, he was strong, he's an advocate, he's a teacher, he's a healer, he's a partner in our medical group. He led us to understand not only how we can better serve the diverse communities that we serve to make lives better, but how we can leverage the strengths and talents of all of us, the unique abilities and attributes that we all bring to the table to make us a strong and vibrant medical group, health plan, workforce. None of us are as smart as all of us. None of us is as strong as all of us together, especially when we look at each of our unique backgrounds and abilities and understandings. It's our multiculturalism that makes us strong. It's our diversity of talent that makes us strong. Frank Meza is a giant. We stand on his shoulders. We appreciate him. We thank him. He's an amazing guy. Thank you, Frank.